The hepatitis B virus is a DNA virus that mostly finds itself within the nucleus of the infected cell. Now, the process of this infection happens in a physiological way called the pathophysiologic, and we will look at the pathophysiology in 4 stages. The first stage is the mode of transmission. The mode of transmission is the way through which the virus is being transmitted from one point to another. And mostly the hepatitis B virus, they are transmitted through blood to blood contact, saliva, semen, and vaginal secretions. Another way they can also be transmitted is mother to child. And mostly this is not by the umbilical vein, but rather the infection happens at the point where the mother is delivering the baby or during labor. And after labor, the close contact of the baby to the mother, when the mother is infected, it can also infect the child as well. Another thing we can talk about is the mucous membrane. So when there is a breach in the skin and the virus finds its way through the mucous membrane, it can infect the body and move into the bloodstream to get to the liver. So basically, these are the most common ways or modes of transmission of the virus. So another thing we can talk about in the pathophysiology is the entry point of the virus. So when the virus finds itself within the bloodstream, its target organ is the liver. So once they reach the liver, they attach themselves into a receptor marker on the liver. So when they are attached to these hepatocyte receptors, they ultimately find themselves inside the cells of the liver. So when they do that, they will go into the nucleus of the cell. That is where they replicate the changes in their DNA to form new viral protein and new viral enzymes. And when these new viral particles break free from these infected cells, they go in out to other nearby cells to infect them. So basically, that is what happens within the liver cells. So it starts from one or few cells of the liver, they infect them, the changes in their DNA, they get new viral replication, and then they start to infect nearby liver cells, right? That is what happens there. So the next step in this pathophysiology is the immune response. So after the virus enter the liver tissues to infect the cell, the immune system try to respond to this process rapidly. So the first response mostly comes from the innate response of the liver, and mostly they are not active or effectively able to clear the virus from the liver itself. So the next immune response that comes from the general immune system is the cytotoxic lymphocyte. They goes into the liver tissues, find those infected cells and destroys them. And this ultimately leads to inflammation of the liver. So when the liver undergoes inflammation, there is cytosis of the cells, that is the death of the cells, and then repairs of those dead cells, right? So when this happens back and forth, it leads to what we call formation of scars. So the inflammation causes structural changes of the liver, and it depreciates its function as it's supposed to do as a liver, right? So basically, that is what happens. The immune response mediated by the immune system causes inflammation of the liver and ultimately changes the shape or the structure of the liver and depreciates its ultimate function. So now the last stage of this pathophysiology is when the liver undergoes real-time changes, either in their function or their structure. So like I said earlier, the changes can be in the acute phase or in the chronic phase. So basically, we have two phases as much as the liver changes are concerned. So we have the acute phase when the liver undergoes a subtle change because of temporary inflammation to the liver. So when the inflammation is only acute, the changes that happens either functionally or structurally is mostly subtle. It's not that much because of the short-time inflammation. However, you are likely to find more liver enzymes within the blood stream. So when you do test, you are likely to find more alanine transferase or aspartate transferase. These enzymes plays major role in protein metabolism. So likely to find those of them more in the bloodstream. And another thing is the chronic phase. So when the inflammation persists for a very long time in the chronic stage of the condition, you're likely to face a lot of changes in the liver. So you will realize that there might be more scarce tissues and the liver will become a host. So cirrhosis of the liver will occur, and ultimately this can lead to liver cancers. So in the chronic stage, it's really, really intense and you don't want to go there. Yes. So you need to maintain your treatment regimen when you are in the chronic state, because in this stage, the liver undergoes a lot of changes, and the most common ones are the scar formation, the liver will become enlarged, and ultimately it can also become cancerous because of constant repair of the liver cells. So now, before we go to the epidemiology of the condition, let's look at few risk factors that may be an important factors for people to become predisposed to the condition. And the most common ones are when a person is having close contact with blood or any type of body fluids. Yes, if the fluid or the blood is suspected to be contaminated with Hep B virus, you're likely to also contract the condition. And also we can talk about pregnancy or mother to child. When you are pregnant and you have it, you stand a chance of being infecting your child. We can also talk about living in an endemic area. So when you live in an area or a place where Hep B is thought to be predominant there, you're likely to contract it. So you're being predisposed to it. And then people working at the healthcare centers, especially those working at the acute health settings, emergency settings, oncology, and chemotherapies, are also predisposed of getting the hepatitis B. And then finally, we can also talk about blood transfusion. Yes, so when you're being transfused, you're also standing a risk of having the condition, because if the blood is suspected to be having the Hep B virus in it. With the epidemiology, it talks about a wide range of numbers, but I will talk about few of them. It is estimated that 90% of people who contract the hepatitis B, mostly in about 6 months time, they recover spontaneously. That means that the immune system is able to clear the virus from their body within 6 months time. However, after 6 months, if the immune system fails to do that, you're likely to move into the chronic stage of the condition. And again, it is estimated that 1% of all persons with hepatitis B mostly die. That is the mortality rate, yes, 1%. But then it is more higher in children, that is 25%. So when you are an adult and you have hepatitis B, and in general mortality, when you take 10 people, only 1% may die from the virus. Yes, but in children, 25% means that when you have about 10 people, yes, you have more than 2 or 3 persons for that. Yes, so it's a serious thing in children. So usually with the consideration of aged people, they have decreased immune response. So mostly when they have the hepatitis B, the tendency of liver abscesses and liver failure is more common and rapid. So their management is quite difficult and they mostly die from this kind of infection. So we have to consider their immune system and how other conditions that may be present, other chronic conditions that may be present, may even increase the risk or the likelihood of the liver to fail. So that is basically about the gerontologic consideration in older adults. So let's look at the signs and symptoms of hepatitis B. Okay, with hepatitis B, the signs and symptoms resembles that of hepatitis A, but they may be variable in certain way, such that with hepatitis B, the incubation period is much more longer compared to that of hepatitis A. Hepatitis A, the incubation period is between 2 to 4 weeks, basically within a month. But for hepatitis B, the incubation period can be prolonged from 1 to 6 months. So you see the difference is very massive. And also the onset of the signs and symptoms mostly are very insidious and variable. They are insidious in the sense that they start gradually, and person from person may experience different signs and symptoms depending on the nature of the person. So in hepatitis B, you realize that the fever and respiratory symptoms in hepatitis A, they are not common in hepatitis B. However, you're likely to find other symptoms that include dysphagia, abdominal pain, anorexia, and fatigue. These signs and symptoms are mostly common and predominant. Again, we can also talk about jaundice. Jaundice usually don't occur in hepatitis B, but when they do occur, mostly they are followed by diarrhea and clay colors too. Yes, so the stool become very clay and not like the golden color of the normal stool that has to be. And lastly, we will also emphasize on splenomegaly and hepatomegaly. So sometimes when you have hepatitis B, your spleen may be enlarged or your liver itself may be enlarged when you palpate. Then it's not all the time that it happens. So, but when they do happens, you will find out that the liver and then the spleen they softly enlarge. And the last thing I will talk about is a cervical lymph node. So when you have hepatitis B, you're likely to have your cervical lymph node subtly enlarged. Okay, so that one is the last symptoms that is physically present for you to see. So now we will look at the management of hepatitis B, and this one will be divided into two. We will look at the medical aspect and then the nursing management of hepatitis. With the medical management of the hepatitis B, the main goal is to minimize the infectious process and also minimize the liver inflammation and ultimately also reduce the signs and symptoms of the hepatitis. So let's look at the common medical approach that are used in the treatment or management of hepatitis B. The first medication mostly used is what we call the alpha interferon. Now, alpha interferon is widely used, and to emphasize more, it is one of those drugs that were first tested upon hepatitis B. So this injection comes in 5 or 10 million units. So when you want to have the 5 million units, you take it once daily for about 24 weeks, or you can also take it for 10 million units and 3 times daily for the same duration, depending on the severity of the patient. And research has shown that when you use the alpha interferon, it leads to a remission in about 1/3 of people that takes it. So when people take them, 1 out of 3 of them will have their symptoms or the infectious process resolved and rapidly. And another drugs that are also used, we have the recombinant form of alpha interferon, we call the PG interferon alpha 2A, mostly also used as the current drugs in management of hepatitis B. We also have other antiviral medication like tenofovir, which is also active and very good as initial therapy for hepatitis B. And lastly, oral nucleoside can also be given to subside the activity of the virus. So basically, in the medical management of hepatitis, these are the most common drugs that are used, and mostly others that are also inclusive are diet therapy and rest. So the physician will encourage the patient to rest more and do less activity to improve the outcome of the recovery. And lastly, diet therapy is also initiated to ensure that the patient has adequate nutritional support to enhance the recovery process. After the virus is being attacked by the direct medication, you will have to also manage the signs and symptoms that are present. So when you have dysphagia and indigestions, you use either antacid to resolve those signs and symptoms. And also when there is fatigue and pain, you can use NSAIDs and other pain medication to help relieve the fatigue or pain. We can also sometimes give IV fluids if they are vomiting or they are diarrhea, or if the patient is not able to eat at all. We can also ensure total parental nutrition or IV fluids that will give adequate glucose to the patient to improve recovery. So with the nursing management of hepatitis B, it is mostly focused on the patient and the family. So we know that the convalescence period of this condition is very long. It takes a long time of about 3 to 4 months before signs and symptoms subside after the initial symptoms are being treated. So it is important for the patient to know self-care and also help the family to adapt into a new way of care to ensure that the patient recovery is smoothly. And it is also focused on educating the patient and their family about prevention. Okay, so what we do is that we educate the patient. If there is any close contact between families and friends, we do contact tracing. We screen them to know if they also have it, and after that, we educate them to care in appropriate, cautious manner in order not to spread the infection. And that's the lifetime notification is also ensure that the patient will stop doing things like drinking. So when you have any type of liver condition, when you drink alcohol, you end up making it worse. So the education is also focused on lifestyle modification and avoiding fatty food, spicy foods, and eating more balanced diet is also important for the patient recovery. And we can also do follow-up care because of the nature of the condition, which also sometimes may lead to stigma. You follow up and then you give appropriate care when necessary. In the last part of this video, we'll talk about the prevention of hepatitis B virus. So the first one is the blood transfusion, and it has been known that blood transfusion, because of screening, it has reduced the risk of contracting any viral infection during transfusion of blood. In the past, transfusion led to a lot of infections, yes, but now because of screening before transfusion, it has helped to eradicate these type of infections. Another thing we can talk about is taking precautionary measures, especially proper disposal of needles and shafts, yes, so that it can help direct contact with a person to infect them. And the other side of prevention is all about immunization. So we have active or passive immunization, yes. So with active immunization, you go in for the shots, yes. So you go in for the most common one that they use recently, the Elizabeth B vaccine. Yes, that one, the shots are given in 1 month apart. It is 2 doses. You take one, and after 1 month, you take the other one. Yes, that one is also important in helping to prevent hepatitis B. When you vaccinate against it, it gives you immunity for about 5 to 10 years before the memory leaves from the immune system. So you can get shot again in about 10 years time. Yes. And the last one I will talk about is the passive immunity. So when you have been exposed to the hepatitis B virus and you have not been vaccinated in the past, you can go for the globulin shot, which will improve the immune system to fight against the infection. All right. So that will be the end of the video. Thanks for watching, and leave a comment in the comment section.